Hi friends, welcome to my channel Optometry Online. The topic for today's video is about myopia, the types of myopia and the recent advances in the management of myopia. Myopia is a progressive eye condition which causes visual loss and reduces the quality of life and also increases the risk of developing other eye disorders. The number of myopic cases have been increasing rapidly globally, and WHO has identified the myopia as one of the global health concerns. So what is myopia? By definition, myopia is defined as the parallel rays of light coming from infinity focused in front of retina with accommodation as at rest. So when the parallel rays of light is ideally should be supposed to be focused on the retina to get a very clear vision, but in myopia, these rays of light get focused anteriorly, thereby causing a blurred distance vision. The symptoms of myopia includes blurred distance vision, headache, eye strain, squeezing of eyes, which is done to compensate for the refractive error, and convergence difficulty. And this is because when the myope, they don't accommodate, so this causes the deficiency in accommodation. The signs of myopia includes deep anterior chamber because the eyeball is little lengthier, muscae volatiles, they are the floating black opacities which is caused by the liquefied vitreous, and the classic against reflex in the retinoscopy. And the prominent eyes, this is because again when the axial length increases, the eyeball looks very prominent. And in retina, we see the myopic fundus changes, namely the in progressive myopia, there is atrophy of the retinal pigment epithelium and the choriocapillaries, which gives a classic myopic appearance to the retina. So we classify myopia etiologically into axial, curvature, positional, index, and accommodative spasm. The most common are the axial and the curvature ones in axial myopia. So the rays of light usually gets focused on retina, but during emmetropization, when the eyeball increases as age increases, the rays of light get focused more anteriorly. So this because of the increase in the axial length. So even a small increase in the axial length by 1 mm can cause a myopic progression of around 3 diopters. So such myopia is called as axial myopia. The second on the list is the curvature myopia. So in curvature myopia, the curvature of the cornea gets steepened. So this even a 1 mm steepening of cornea curvature can cause a myopia of around 6 to 7 diopters. Clinically, myopia can be classified into congenital myopia, simple myopia, degenerative myopia, and acquired myopia. So what is congenital myopia? So this congenital myopia, it is usually present since birth and is associated with the preterm babies and babies with other genetic disorders, and they usually have a squint. And since the refractive error is of very high degree, and they have the risk of developing amblyopia. The second is a simple myopia. This is the most common type and is because of the physiological variation in the length of the eyeball. It is also called as school myopia because it usually starts at around 7 to 10 years of age, and as the growth increases, the myopia also increases, and it usually stabilizes after the teenage and is usually lesser than 5 diopters. This is the most common type of myopia all around the world. The third on the list is the pathological myopia. This is where it is a rapid degenerative process. The rapid increase in axial length is noted beyond the biological variation, causing the degenerative changes of the retina and the choroid, and they usually have a refractive error of more than 10 to 20 diopters. So next is the acquired myopia. There is a list of other reasons which can cause myopia. The first on the list is the curvature of myopia, which is because of the corneal ectasias. So like keratoconus or keratoglobus, when the corneal curvature alters, so this can cause a myopic shift in refraction. The second is index myopia. This happens in uncontrolled diabetes mellitus or in case of nuclear sclerosis, where the index of the crystalline lens changes can cause a myopic shift. The third is the positional myopia, when the IOL or the lens moves anteriorly into the anterior chamber, it will cause a myopic shift. Excess accommodation. So when you're going to overcut or you're going to accommodate a lot, it will lead to a myopic shift. The last on the list is the drug induced. Certain drugs like cholinergic drugs can cause myopia. So what are the management of myopia? The classic conventional mode of treatment is the glasses. We usually give a concave lenses for the treatment of myopia, and if the individual feels that the cosmetic correction is not very appealing, they can go in for contact lenses, which is also equally good for correcting myopia. So the third on the list is the surgery, which is called as LASIK surgery, where a small amount of corneal tissue is ablated to compensate for the refractive error. So these three are the most common methods of management of myopia. So what's new is the orthokeratology and the lenses for peripheral reducing the peripheral defocus. So what is orthokeratology? Orthokeratology is a specialized contact lens which will temporarily reshape the cornea to improve the vision. So they are the lenses which is mapped according to the corneal topography, and it is worn at night, and they act around the cornea and when one sleeps. So it is a reversible one. So they have to take off the contact lenses in the morning. So this causes central corneal flattening, thereby allowing the rays of light to focus on the retina. So when one feels when the LASIK is not as surgical, is not properly won't be much of useful, they can go in for orthocare lenses, which will temporarily flatten the cornea, but usually the changes are usually reversible. The other one is the lenses which to reduce the peripheral defocus. The recent studies have proved that in conventional glass treatment, there is a hypertrophic defocus in the periphery, which can give rise to increase in axial length. So the newer ones in the market have proved that any lenses which has got the ability to reduce the peripheral defocus can halt the myopic progression by around 50 to 60%. So the newer lenses have the central clear zone with the peripheral aspheric zone to compensate for the peripheral defocus. So such lenses which are going to use in such a way, they reduces the myopic progression. So they are still under study, but they claim that such kind of lenses are much better than the regular conventional lenses to prevent the myopic progression. That's all for the video today. If you want to have a more optometry related information, kindly subscribe my channel. Thanks for watching.